Welcome back. Dr. Kim, continuing on with the topic of salt, which we were talking about before the break, I've often heard people say that if you have high blood pressure or hypertension, that salt is bad for you. Can you comment on that?
Here's a huge controversy between the two camps of scientists. People say, a group of people say, salt is bad for your hypertension if your hypertension is sodium sensitive.
So what are they really saying?
To me, it sounds like a circular logic.
It doesn't sound like there's any news there.
So it's like salt is bad if salt is bad.
Salt is bad, right? Okay.
But the fact is, we need a certain amount of salt every day for our metabolism.
Right, minimum requirement.
And our immune system will be totally confused if we lack of salt.
Right.
So we have to take some salt. So it's wrong to expect that no sodium diet is possible. No, it is not possible.
So it's not so much then about the salt as about...
So these days there are more sensible positions regarding this debate. They say it is not about salt. It is the balance between potassium and sodium.
So potassium and sodium in your body, that's the balance.
So they say potassium, which is essential nutrient anyhow.
Right.
And then the potassium, if our body is supplied with enough potassium, the body can handle sodium quite well, actually.
So if you're giving your body enough potassium, you can have a diet with some salt in it.
And we just mentioned the linkages between hypertension and diabetes, right?
Right.
Potassium cuts that link too.
So it's a powerful ally.
Potassium is a very, very important nutrient.
And potassium can be found in what type of foods? Bananas?
Tomato and potato.
Right.
And grapefruit.
Grapefruit, just to name a few. I'm sure there's lots.
Very healthful foods.
Right.
No matter whether you have diabetes or hypertension.
Right.
Those are good foods anyhow for your body.
So important to know that.
By the way, the chemical name of potassium is kalium.
Kalium.
And you must have heard the words like alkaline.
Absolutely.
They are from the same word, kalium, alkaline.
Interesting. So that's where that comes from.
So the alkaline balance, acidic balance, they all relate to this potassium.
Interesting. So it's all stemming from the same
thing.
Potassium
is a very, very important nutrient.
Right. And you were saying before in the first section when we were talking about the side effects of prescription drugs, that in fact, when you're on these prescription drugs, that your blood pressure actually becomes sensitive to salt.
That's correct. One of the classes of the drugs we mentioned, diuretics in particular. Diuretics removes the potassium from the body. So actually, body becomes more sodium sensitive.
Right. So you can't have as much salt because you don't have the potassium in your system.
That it worsens hypertension, and you have to take more. It worsens, you have to take more. So vicious cycle sets in right there.
Right. So Dr. Kim, you said earlier that we need salt in our diet.
That's correct.
Is there a good salt out there?
I can say there's something called bamboo salt.
Bamboo salt.
It's very popular in the Orient. And then basically it's the salt from the sea, not from mine.
Right.
And then it is placed inside the bamboo, and then it is burnt at a very high temperature, 1,000 degrees Celsius.
So what is the impact of that?
Then molecular structure of the salt changes. It used to be sodium chloride.
Right.
Now it becomes potassium chloride. So they say it cures hypertension. Of course, there was a lot of...
Because you're already balancing the potassium and the sodium in the salt itself.
Correct. There was a big debate about this, but now the scientific evidence accumulates more and more in support of this bamboo salt. It's a very healthful salt.
So that definitely sounds like something to keep our eye on.
But it's a little bit more expensive than ordinary table salt. But I see its benefit obviously overweighs
the cost.
A little bit of extra cost.
Slight increase in the cost,
I really recommend this bamboo salt to everybody.
Absolutely, so we'll keep that in mind. So Dr. Kim, let's shift gears. Let's talk about the impact of exercise on hypertension.
I'm glad you mentioned that. Exercise is one of the most underemphasized issue regarding hypertension.
Right.
Let me give you the statistics first. If a person walks 40 minutes every day, briskly,
Right.
30% of hypertensive patients become normal permanently.
That's incredible.
It's good news.
Yeah, let's stop there. This is big because what you're talking about is something as simple as walking.
As opposed to, we sound so hopeless when you're talking about these pharmaceutical
Absolutely.
drugs, but something as simple as this walking every day, 40 minutes,
Right.
30% of patients become normal permanently.
Just from walking.
Yeah.
So this is not complicated. This is not hard to do.
Yeah, of course, it takes some discipline.
Sure.
Yeah, but it's simple.
Discipline versus pharmaceutical drugs for the rest of your life. I don't know.
And 40
that there's
minutes
a
of walking
comparison.
is good for your health anyhow.
Absolutely.
Isn't it?
That's incredible.
Yeah. Everybody should do this.
So exercise, it's simple. It's a simple solution. And what about, you mentioned something about acupressure in conjunction with exercise?
We just mentioned, let me just say it again.
Yeah.
40 minutes of everyday walking.
This is not something to ignore.
Okay.
This is a big point.
And if you combine this 40 minutes
Right.
of walking with simple acupressure.
And acupressure is?
Gentle massaging of these acupuncture points.
Right.
There is a hollow points between the skull and neck.
Right. And
If
this is going to be on the website.
Yeah,
this
we'll
information.
give a detailed map
Okay,
where to give massage. And if you massage there on a regular basis, gently, 80% of people become normal within 6 weeks.
Whoa. So 80%
No
of
drugs?
people with high blood pressure, if they're combining that 40 minutes of walking
Yes.
with acupressure
Yeah.
and deep breathing.
Deep breathing, meditation. Deep breathing helps with the stress.
Everything.
Stress really increases
Okay,
your
so
blood
Dr.
pressure.
Kim, you're
right?
giving us an incredibly simple solution. Why don't people do this?
Misconception, widespread misconception. And then people think that when you have a disease, you have to take drugs. For some diseases, that's true. But for hypertension, there are other things you can
There's
do.
options, which
That's
actually I
correct.
think this is a really good point to bring this up at this moment, Dr. Kim, is just to remind viewers not to stop taking their prescription drugs. They may be really excited about what we're talking about on the show
That's
today,
very important.
but don't just stop.
Yeah, that's very important because these hypertensive patients are already so much dependent upon these chemical drugs. If you stop it abruptly, it's very dangerous.
Serious ramifications.
Yeah. So any suspension, any reduction of these prescription drugs should be consulted with your physician in prior.
Right. So
Otherwise,
that's an
it's
essential
dangerous.
point.
Yeah, that's an
Absolutely.
essential point. Yeah.
Yeah, definitely. So, Dr. Kim, we've spoken about a lot of natural remedies for hypertension. We've spoken about LBM, P700, the DASH method, and then just more recently we spoke about exercise and acupressure. So as somebody watching who has hypertension, how do they know how to combine, what to choose? How do we rank these natural methods?
That's a very good question. Let me go slow here.
Great.
For the symptoms, for the control of hypertension symptoms, I recommend LBM treatment and acupressure.
Right, so for symptomatic relief.
Yeah, because the effects are faster and you can experience the control of this high blood pressure symptom very quickly.
Right.
Yeah, this acupressure especially.
Right.
And the LBM also are very safe treatment for the symptoms of this high blood pressure. But for fundamental, long-term treatment, if you want to expect the reversal of hypertension, I would recommend exercise and P700 hypertension formula.
So that's more of the long-term, sustained
So,
normalizing, as you call it.
So we are actually taking two-pronged approach.
Right.
One symptomatic approach, one long-term approach.
That makes sense.
Yeah, for symptomatic approach, you take LBM and then acupressure.
Right.
For long-term approach, exercise and P700.
Right, right.
So that's the combination I would rather recommend.
Yeah, it sounds like it. And it also sounds, Dr. Kim, like there are a lot of exciting developments in the treatment of hypertension from a natural perspective.
We can be very hopeful here.
And it looks like there's a lot of new ones on the horizon as well. Yeah. And so we should mention again the website, which will be shown on the screen. And so if you have any questions or want to know more information about anything we've spoken about on the show, just simply access the website. In the meantime, I think it's really important to remind people that don't despair. We're not without hope if we have hypertension. We can be hopeful.
Yeah.
So I want to thank you, Dr. Kim, for being my guest on the show, for coming and sharing with us this insight and wisdom into this issue of hypertension.
My pleasure.
Thanks so much. Hi, I'm Christina Seston, and you're watching a special edition of The Truth About Diabetes. If you or someone you know has diabetes, this is important television to watch. If your children are overweight or diabetic, this show may contain critical information. Dr. Kim is here to talk about this deadly disease of diabetes. So, Dr. Kim, 17 million cases of diabetes in the U.S. alone.
That's what I heard.
2,500 new cases diagnosed every day. So there are people that call this an epidemic.
That's correct.
So what is it about this incredibly high incidence of diabetes in the last decade?
It is not only in the States. It's all over the world. These days we observe explosive growth of diabetes incidence all over the world. So for the last 10 years, even children, a lot of children get diabetes. So this is a global epidemic.
Right, right. And so we're going to talk a little bit more about this upsurge later in the show. But in the meantime, I've heard statistics reporting that 45% increase in childhood diabetes. Is this correct?
That's what I heard. And in China, half of new diabetic patients are children. And then in Japan, 21% of all children are diabetic. So we are talking about something very serious here.
Yes, yes. It's very, very high. So, Dr. Kim, for those of us that don't have diabetes, can you explain to us what diabetes is?
Diabetes is basically a person's ability to metabolize carbohydrate is impaired.
Right.
So basically blood sugar does not get burnt inside the muscle. It stays in the blood. Of course, you observe high blood sugar in the blood. So that's what we say diabetes is.
Right, right. And we've all heard these terms, type 1 and type 2. Yeah. Can you explain the difference for us?
Yeah. Basically, type 1 is for certain reasons such as what we call autoimmune process. For any reason, pancreas of a person does not produce insulin. So they have to rely on insulin injections every day. So, but in the meantime, type 2 diabetes is even though the pancreas produces insulin, it's not sufficient, or even though a sufficient amount of insulin is produced, it is not used efficiently because body resists its own insulin.
Right.
So type 1, type 2 are different like that.
So Dr. Kim, what is it about childhood diabetes that is so bad?
Because for a few reasons, diabetes is basically a progressive disease. Therefore, if a person gets diabetic at the early stage of their life, they are getting more and more serious at the later stage of their life.
Right.
Another reason, which is very serious, is if people begin to use these pharmaceutical drugs in their teens,
right,
they begin to lose these pharmaceutical drugs begin to lose their effectiveness over time. So in their late 20s, in their 30s, these drugs begin to lose their effectiveness. So they have to use more dosages or they have to rely on insulin. But even these, they begin to lose their effectiveness. So in their 30s, in their early 30s, they will face this terminal stage of diabetes where no drugs, no injection work. And then they just will begin to experience blindness, amputation, kidney failure. So, in 10 years, this children's diabetes epidemic, if this thing continues, in 10 years, the world is going to face a global crisis here.
This is serious.
This is serious.
Yes. So we'll talk more about the pharmaceutical drugs a bit later. But in the meantime, I've heard that people saying children outgrow diabetes. Is this correct?
Absolutely not true. Nothing is
Not
further
true.
from the truth. Children don't grow out of diabetes. They don't outgrow diabetes. It's progressive disease. They are getting worse and worse. So it's just wishful thinking That's not true.
Strictly wishful thinking. No cases of children growing out of diabetes then. So, Dr. Kim, I've also heard diabetes referred to as the silent killer.
Yeah.
What does that mean?
Because even though you have diabetes, you don't feel acute pain right away until you reach this terminal stage where you have all the complications surface. Until then, you don't actually feel this high blood sugar.
So what is that length of time leading up to it? You say when you first have diabetes, it sounds like you might not even know that you have diabetes before the symptoms show. Is that correct?
Yeah, but even before the diagnosis, according to the statistics, once a person is diagnosed as diabetic, it's quite likely that 7 years before the diagnosis,
7 years.
Yeah, onset already started. And then statistically, even though individual case varies, statistically, every 10 years, we expect to see the rise of about 100 milligrams per deciliter. This progresses.
And so somebody who has diabetes, what are they doing now to control this disease?
Right now, basically, there are three things they do.
Right.
At first, they try to control their blood glucose by diet and exercise, which is very difficult. Later on, we'll elaborate why it's unrealistic to expect people to control their blood glucose by just diet and exercise. And secondly, if diet and exercise doesn't work, they rely on pharmaceutical drugs. If that doesn't work, they rely on insulin injection. If insulin injection doesn't work, then people are facing despair.
So there's no hope.
No hope.
So when you're talking about the pharmaceutical drugs, are there any kind of side effects involved with that?
Exactly. Every pharmaceutical drug have inherent risk. But for this diabetes drug, even though they are over a short period of time, they are very valuable for their therapeutic value.
So they do something positive in the fight against diabetes.
Yeah, they control blood glucose temporarily. They are very good for that, but they are good only for that. So over time, they lose their effectiveness. So after 7 years,
yeah, you mentioned 7 years.
Yeah.
They start losing
10
their
years,
effectiveness.
even though people increase the dosage, it doesn't work. So at that time, even though it doesn't help to control blood sugar, it only have this horrible side effects: liver failure, kidney failure, brain, heart, just name it.
So it sounds like at this point, with those things that you're listing off there, that they sound worse than the disease of diabetes itself.
Oh, some people even argue that the half of the kidney failure of diabetic patients are actually from these drugs, not from diabetes. So we are talking about, we just don't know. We reach a certain point where we don't know which one is worse.
Which one is worse?
Yeah.
Right. So it all sounds rather hopeless. And I've heard people say that there is no cure for diabetes. So in that case, we may as well just befriend this disease. What do you have to say about that?
I came to this show to disagree with that opinion. I know of a few actually quite effective, quite safe, long-term solutions to the problems of diabetes. There are many, natural treatment, which are very safe, which have permanent effects, very good treatments. So I just disagree completely with such an assertion that there's no hope. No, there is hope. And then I disagree when people say we have to be friends with diabetes. They're your enemy. It is your enemy. It's not your friend.
Dr. Kim, you spoke about something called P700. Can
Yes.
you tell us more about what that is?
Yes, P700 is a name for the invention invented by University of Calgary long time ago, 20 years ago. So P700 is basically based on natural herbs, and then there are tremendous reports about its effects and its safety.
Yeah. So Dr. Kim, tell us about P700. What are its origins? How did it come to be?
Everything started about 20 years ago. There was a Malaysian lady, 70-year-old lady, who was living in Calgary, seriously diabetic, very frail with all these complications of diabetes. Kidney failure, her kidneys were not functioning at all.
Right.
And then gangrene infection was so serious, so they had to they have to amputate both of her legs.
Wow.
So she was checked into the hospital for the surgery.
Right. So she was facing the amputation of both legs.
Yeah.
Yeah. So I gather that's not the end of the story.
Yeah.
Go on.
So this lady refused to have the operation. She decided to have at least some life with dignity rather than have a bit longer remaining life with both legs amputated.
Right.
So she just refused the operation and checked herself out. And she went back to her own native country, Malaysia.
Malaysia,
Yeah.
right.
And then she tried all kinds of this folklore, herbal, anything, because she
had nothing to lose.
Nothing to lose.
Right.
But the story becomes interesting when she came back.
Because what happened?
After 6 months, she came back completely cured. Kidney problems gone, diabetes gone, gangrene gone.
This is incredible.
So that's obviously the response of this university. So they just couldn't believe what they saw. So they begin to study the treatments, the methods.
Everything that she'd done while she was in Malaysia.
That's correct. And then from a few candidates, an herb surfaced as the most likely candidate.
So they came down with the one that they felt was the real cause of her amazing healing.
And then they started animal studies, they studied pharmacological studies, they did toxicity test, and they did clinical test. And then provincial government of Alberta got involved.
Right, so it caught their notice because obviously this was big. This was big news.
Yeah, and then the institute that started this invention is a very prestigious diabetic research in North America. So
this is at the University of Calgary?
Yeah, and then that particular institute is called Julia McFarlane Study Center of Diabetic Studies.
Right.
Yeah.
So these are incredible results, Dr.
Yeah,
Kim.
that's
and
correct.
I mean, I'm curious, what are people saying about this?
Oh, headlines in Asian countries, headline news media coverages, and then the Chinese Diabetic Association called this ideal cure. Korean Diabetic Association calls it breakthrough cure. Doctors after doctors. Right now, even without any advertisement, we have about 50,000 users.
So people are excited about this. This is generating a lot of excitement.
And then a lot of TV coverages, and people are excited. The studies after studies. Right now, it is already an established science. So right now, thousands of doctors are very open-minded toward this herbal treatment, and about our particular product, the leaderships of American Diabetic Associations recommend this treatment to their own patients. Many doctors are using this product on themselves. Right now, there is even a forum of doctors in which they exchange their first-hand clinical experiences about this product. So doctors are excited about this product too.
So how does P700 differ from the current treatments that we talked about earlier?
Basically, there are a few fundamental differences. While these pharmaceutical drugs and insulin injections are just for temporary control of blood sugar, P700 addresses fundamental problem. We are talking about reversal of diabetes. People becoming normal. 70% of users become normal. So after they become normal, they don't have to use pharmaceutical drugs. They don't have to use insulin injection. They don't even have to use this P700 either. So we are talking about fundamental changes versus temporary control. That's one difference. Second, but still probably this is more important for some people, this is safe.
No side effects.
No side effects. And then actually all the ingredients are classified as foods in Southeast Asian countries.
So food, not drugs.
Food, not drugs.
Right. Well, but Dr. Kim, I'm curious about how P700 brings about permanent change.
Let me tell you that P700 shows that beta cell is the cells in the pancreas that produce insulin.
Right.
The numbers and strength of beta cells improve. Therefore, that's a molecular level change. Fundamental change. It doesn't disappear overnight. Secondly, with the use of P700, insulin resistance is gone. We call it upregulation of insulin resistance. Therefore, that's also fundamental molecular level change.
You're not talking about symptomatic relief here.
No. So once those changes happen, it doesn't disappear. Therefore, even months or even years after they become normal, they stay normal. Therefore, we call normalizer.
Right.
People became normal.
It sounds like, I mean, you're dancing around a word here. Cure is what it sounds like.
It depends on what you mean by cure. If cure means we identify one or two simple causes of a disease, and you get rid of those simple one or two identified causes, if that is meant by cure, P700 is not a cure. But if a person takes a certain treatment or certain food or a certain drug, and then people becomes normal, if we call that a cure, we can call this a cure. But it's a matter of semantics.
Right, that's what it sounds like. But it sounds like it's making a huge difference in a lot of people's lives from what you're talking about.
That's correct.
Yeah. And Dr. Kim, you mentioned earlier that there were numerous natural herbal methods for treating diabetes.
Yeah.
So what are the other methods?
Right now, there are about more than 2,000 herbs and plant-based medicines, drugs that are shown to be effective to control blood glucose. But what I'm saying is, it is not true that all herbal products are safe. All herbal products.
So of these 2,000 herbs you mentioned, they're not all necessarily going to work
and then I say 1,900 of them are toxic. So there are very dangerous herbs.
So this is not something to just enter into lightly.
Yeah. For example, some are toxic, even fatal. So, and other herbs, actually most of the diabetic herbs we see on the market in North America, they are anti-diabetic. They lower blood glucose by inducing artificial indigestion, meaning that even if people take food, it doesn't get digested. Therefore, you see lower blood glucose. I think that's not healthy. But anyhow, if you just look at the end result, it lowers blood glucose.
Right.
But it lowers blood glucose at a very high price.
But let's go back to P700 for a moment. Mm-hmm. You said during the break that people that don't have diabetes can take this drug as well. Or, sorry, this drug, it's not. It's a natural remedy.
That's correct.
Say more about that.
For example, myself, I don't have diabetes. My children, they don't have diabetes, but we all take this. The reason is, first, let's talk about pancreas. If we keep our beta cells healthy,
right,
and then about the insulin resistance, if we keep our insulin resistance upregulated, basically we are preventing diabetes.
Right.
So that's the fundamental mechanism that leads to the diabetes. If we cut those mechanisms before it becomes diabetic, of course we are preventing. Actually, we did quite a bit of study here. We at first made many animals become diabetic. So there's a mechanism that triggers the animal to become diabetic. And then one group, this P700 was given. The other control group was not given. And then that group that was not given this P700, they all became diabetic, while 70% of the animals that were given P700, they didn't become diabetic. Anyhow, all the ingredients are regarded good for your health anyhow. So I take this P700 as a general health promotion, not particularly for diabetes.
So general health.
Yes.
And preventative.
Yeah, that's correct.
For diabetes.
That's correct.
And so what's the correlation between diabetes and weight loss, or weight gain, I should say?
Do you remember the vicious cycle we just mentioned just a moment ago? Because of that, once you have diabetes, it's almost impossible to control weight.
You've got everything against you.
Yeah. And then if you are obese, it is almost impossible to control diabetes. So I'm quite frustrated when people say, when you have diabetes, you should control your weight. It's just
how do you do it?
How do you do it? You're just repeating the question. It's not suggesting a solution.
Right.
So for diabetes people, there are inherent reasons why they find it so difficult to control their weight. So there should be something else except in Indonesian to saying you should control diet. It's just repeating the question.
Yeah. So, Dr. Kim, are you talking about a medical discovery here? Because it sure sounds like that.
It depends on what the medical discovery is. Medical discovery as opposed to dietary discovery. Medical discovery as opposed to lifestyle discovery. I just don't know what to call, but I'm just telling you, here's the product. 50,000 people used it. They got tremendously happier. And then scientists tested this.
Right.
So I just don't know what to call. But
so whatever you call it, it's having an impact.
Impact, yes,
Yeah.
that's correct.
Dr. Kim, is P700 the only natural remedy in the fight against diabetes that you would recommend?
For today's show, I'm glad to introduce two more. The 6-flavor tea, which is a traditional Chinese
6-flavor tea.
Yeah. In Chinese, I can pronounce 6味地黄黄.
Okay, I'm going to leave that up to you. Okay, 6-taste tea.
Yeah.
Great.
And then another tongue twister. This is from India. Pterocarpus marsupium.
Okay, I'll work on that one as well. So you've mentioned two different remedies.
That's correct.
Let's start with the 6.
You can also call it Indian Kino.
Indian Kino.
But that's better.
Okay, let's work with that one.
Yeah.
So let's start with the 6-taste tea
Yeah.
that you talked about. Can you tell us a little bit? You said it's a traditional Chinese formulation.
It has been used in Asia for many thousand years.
It's very old.
Very old. And then it has been recognized as a very effective diabetes treatment by many governments in Asia. It is recorded in most pharmacopoeia of the oldest Asian countries.
So, Dr. Kim, for the viewers watching, how do we make 6-taste tea?
Basically, it's composed of 6 herbs. 6 taste.
6 taste, 6 herbs. That's logical.
That's correct. And then they are very cheap. It is very common herbs.
Very available, very inexpensive.
Yeah.
Where would I go to? A Chinese herbal
So
store?
if you take the list from the internet site we are showing here.
Right, so stay tuned. We'll be showing that website and you can get the specific information.
Yeah, very common. Even without taking the list of the herbs, if you go to a Chinese herb store and say, can I get the herbs for 6-flavored tea, they know. And then I'm excited about this formula, not because of its cheap price, but because of its safety.
So say more about that.
Compared with pharmaceutical drugs, this is way, way safer. It doesn't have any side effects.
Hold on a second here, because this is incredible. What you're saying, that this natural remedy, this formulation you can make yourself for $20 a month is safer than a pharmaceutical prescription
That's what
you're
I'm
getting
saying.
from your doctor.
A lot safer. They don't have this herbal treatment have no side effects.
Safe and cheap and no side effects.
Yeah,
That's
and
what we want to hear.
Therefore, before these pharmaceutical drugs, I say people should try this.
Right. Okay. So let's talk about the other remedy you mentioned briefly. I believe
Indian treatment.
Indian treatment, Pterocarpus marsupium.
You are doing very well.
Right. And so how does this? Can I call it PMT?
Yeah, Indian Kino.
Indian Kino. So
Yeah.
how does this differ from the 6-taste tea in terms of its applicability to, you mentioned type 1 diabetes and type 2 diabetes?
Yeah, there is actually a very particular reason why I'm quite excited about this Indian Kino, PMT.
Right.
I believe some of their claims about its effect on type 1 diabetes are convincing.
So, Dr. Kim, you've mentioned 6-taste tea, PMT, and we've talked about P700 as well. Are there many other herbal formulations out
As
there?
I said, there are more than 2,000.
More than 2,000 individual herbs, and you talked before about how a lot of these herbs are actually toxic. So I'm curious then, so how can people then get more information on these herbal formulations that we haven't covered in the show today?
Before it was very difficult. Before there were not many information, but these days situation improved. There are a lot of available already, quite available in the internet. So in the website we are introducing at the end of this show, we refer to those websites, and there are many very understandable, very well written papers how to use. Also, I mentioned this 7 criteria.
Right, you mentioned that earlier in the show.
Yeah, with which you can guide through this 2,000 herbal treatments. We have to avoid certain widespread myths. All herbal treatments are safe? No. There are many fatally dangerous herbal treatments. So
this doesn't get a lot of airtime, what you're talking about, because it seems to me to be a widespread understanding that naturopathic or all herbal, all natural formulations are quite safe and benign. Well, you're saying that's not true.
But that's not true. So what is not true either is that it is also wrong to believe that all natural treatments are not effective. That's also wrong. Some natural treatments are very effective, very good, but it's also wrong that all natural treatments are safe. No, some are very dangerous.
So you need to approach this topic with
common
sense and do some research. You're saying there's lots of websites. You're also mentioning that at the end of the show we're going to be showing the website that you can go to for more information specific to what you're talking about. So very interesting. So you're not a medical doctor.
I'm not a medical doctor.
And you're not here giving medical advice.
I'm not giving medical. I'm today giving a view on the recent exciting development of this natural treatment on diabetes.
Because there's a lot here to talk about, and it's been very exciting.
We are very excited about this recent development.
I can see why. That's great. So, Dr. Kim, thank you so much for being on the show. It's been so interesting.
Thank you very much.
Again, you've been watching The Truth About Diabetes. And if you have any questions, please visit the website that's listed on your screen. Dr. Kim, your interest and desire to help in this way gives us all so much more hope for diabetes.
Thank you very much for
inviting me here.
Thank you again
for being my guest on the show today.
Much,